Hola, muy buenas noches.
Good evening, everyone.
Son las 19 horas.
It is 7
En
p.m.
punto de este domingo 20 de mayo de
This
2020.
Sunday, May
Estamos en el
20th of
Palacio Nacional
2020. We are in the National
de
Palace
México, en la Ciudad de México.
in Mexico City.
Vamos a iniciar la conferencia de prensa
Let's
diaria
begin with the daily
sobre la situación
conference regarding
actualmente
the
de COVID, la
COVID
enfermedad causada
pandemic
por el nuevo
situation,
coronavirus
which is the disease
SARS-CoV-2.
caused by the new
Hoy vamos a
coronavirus
tener dos
SARS-CoV-2.
elementos o tres,
They will
pero
be
vamos a iniciar con el informe técnico que
talking
presentaré yo
about
mismo.
three
Y
different
posteriormente
subjects.
vamos a
Let's
tener
begin with the daily
un
technical
espacio donde
report
vamos a
that I
hablar
will be
sobre
presenting myself,
la
and
maternidad.
then we
Obviamente
will
hoy
be
es Día de
talking
las
about
Madres. Felicidades a todas
maternity.
las mujeres
Obviously, today is Mother's Day.
que tienen
Congratulations to
esta
all,
dicha de ser madres.
all
Pero
women
vamos a hablar de
that
algunos
have the
elementos
joy of
relacionados
being
con
mothers.
la maternidad y
So we will be
la
talking
doctora
about
Nadine
some
Gassman, titular de InMujeres, nos compartió un video,
elements
¿cierto?
related
Que
to
vamos a proyectar
maternity. We'll be showing a
inmediatamente
video
antes de
as
la
well.
sesión de preguntas y respuestas. Y también hoy tenemos el gusto y el privilegio de
Today we
que
also have the
varias mujeres que son madres
privilege
nos han permitido tener sus comentarios y sobre todo
of
preguntas. Y las
showing
hemos recibido
some
con enorme gusto,
questions
porque son
and
preguntas que
comments that
consideramos
have
muy
been
útiles
shared
para
to
la
us
sociedad, no solamente para
by
otras
different
madres que pudieran
women that are
beneficiarse de
mothers
conocer la
in this
pregunta,
country.
conocer la
And
respuesta,
this can be very
sino en
beneficial
general
to
en las
not only
familias, en las
to other
comunidades.
mothers, but
Estas
also in
preguntas
general to the
seguramente han surgido a
community,
lo
to the
largo
general
de
community,
estas
to the
semanas de la pandemia,
general
en las que
society.
todavía
There's
nos
a lot of
restan en esta primera
questions that
fase
have
y en las
that
próximas
remain
fases que
within the
tendremos.
general
Entonces, ese
population,
es
and
el
then
programa principal de hoy,
this will be
responder a estas
a good way of
preguntas.
addressing
Vamos
some
a
of those
proyectar
questions.
los videos
So those
de
will
las
be
madres de familia
the
y
three main
comentarios
parts of this
sobre lo que
conference.
ellas
We'll
nos
be
externen.
presenting these
Entonces,
questions in the
vamos a
video
iniciar el informe
format.
técnico. Esta vez lo
So let's begin
presentaré
with
desde
the
aquí.
daily technical report. I'll
Hoy
be
es el
presenting
día
it from here
49 de la
today.
Jornada
Today
Nacional
is day
de Sana
number
Distancia.
49
Tenemos,
of the National Safe
estamos
Distance campaign.
prácticamente a 3 semanas de terminar
We're basically
el
3
periodo
weeks
originalmente
from
contemplado.
finishing
Ya hemos dicho que la próxima semana en la conferencia matutina del
the
presidente
original
vamos a
period.
presentar
We've
elementos
talked about
sobre
how next week
el
we'll,
cambio de
we'll be
modalidad de
presenting
las medidas
some
de
elements
prevención.
regarding the
Entonces,
modifications to the prevention
a nivel
measures.
mundial tenemos
The
3.917.000
international context
casos confirmados,
data
personas que
shows
han
that we
tenido
have
COVID desde que empezó la pandemia. Estamos casi en los
almost
4
4
millones.
million,
Y
almost
recordar
4
que estos
million
son
confirmed
personas que
cases
en algún momento lo han
worldwide.
tenido.
And
Pero
remember, all of these
prevalecen
people
por actividad de
are people
enfermedad
who at some point have had
1.126.000, que
the
son las
disease.
personas
But
que en los últimos 14 días han presentado
we
la
have
enfermedad.
over 1 million
Y
people
estas
who remain
personas
with
representan
the disease
el 29%
being
de las
actively
personas que
presented
han
in
tenido
them,
enfermedad.
meaning they've
7%
showed
es la
symptoms for the
mortalidad
past
acumulada, la
14 days.
letalidad, es decir, la
We have
proporción de personas que
a
teniendo COVID
cumulative fatality
desafortunadamente han
rate
perdido la vida.
of
Y
7%,
la distribución
meaning
regional a
the
nivel del
proportion of
mundo
people who,
claramente está
after
en
being
disminución
infected
en la
with
región
COVID, have
europea, pero
unfortunately
permanece con
lost
una importante
their
representación
lives,
el continente americano.
and
Asimismo, que ya lo empezamos a
we
mencionar desde hace
continue to
algunos días,
share a big
la
part
zona
of
del
the
Mediterráneo oriental,
active pandemic in the region
que
of
es
the
la
Americas.
zona de Asia que está hasta el
As you can see
extremo
in this chart,
oriental del
the
mar
Americas is
Mediterráneo. Los
overrepresented
países árabes principalmente
with
están cada vez más
over
con actividad
40%,
y representando una
and
proporción mayor
we are
del
also
turismo
seeing an
en el mundo.
increase
Lo
in the
esperable es
representation
que
of the
esto seguirá creciendo
Arab
por varias semanas
countries.
más, en tanto que irá disminuyendo en Europa. La siguiente, por
And
favor.
of course, we will continue
Cuando
to
vemos
see
los
an
números
increase
en
in
México que se contabilizan a partir del
their
28 de
representation in
febrero,
the
fecha
chart.
en que tuvimos el
Let's
primer
look at
caso
the national
confirmado,
data.
hemos registrado ya
We've registered
35.022 personas que en algún momento
35,022
tuvieron COVID y este fue confirmado por
confirmed
laboratorio.
cases ever since the
Sin embargo,
pandemic started in our country.
8.457 de estas personas lo han tenido en
Out
los
of
últimos
these,
14 días
only
y lo consideramos, por lo tanto, las personas que
8,457
en este
have
momento tienen
showed
capacidad de
symptoms during
contagiar y
the
tener
past
enfermedad
14 days.
activa.
And these are what
Muy
we call the
desafortunadamente,
active cases, which are the ones
3.465 personas han perdido la vida directamente por COVID
that are at
y
risk of
sus complicaciones, siendo
infecting
de mayor
others.
frecuencia la insuficiencia
We've had
respiratoria, el daño pulmonar crónico, que es el
3,465
condicionante
unfortunate
más
fatalities.
frecuente de muerte. 130.956 han sido estudiadas. Esto quiere
And
decir personas
overall,
que
we've
fueron
studied
consideradas como casos sospechosos, personas que tenían los
130,900,
síntomas de COVID,
yeah,
fueron estudiadas por pruebas de
130,956
laboratorio
people,
y resultaron 75.955 de ellas
uh,
negativas y
out of which over 75,000 have
resultaron positivas.
tested
Permanecen
negative,
todavía en estudio casi
and
20.000
as we said,
personas, como conocen
over
bien. Esta
35,000
cifra
have
cambia
tested
día a día
positive,
porque se
and we
permanece
currently
con las
have
personas que han
almost
sido
20,000
nuevamente
people who are
identificadas por primera vez como
still
casos
cataloged
sospechosos
as
y que
suspect cases,
permanecen por
meaning
un
we
par
are
de
waiting
días
for
en
the test
periodo de
results to come
estudio.
out.
La siguiente, por favor. En nuestro mapa de casos acumulados, solamente el estado de
This is
Colima
our
ha
cumulative
tenido
case
menos de 100 casos o hasta 100
distribution
casos, pero
map
todos los demás han tenido más de 100 casos
per
en
state.
algunas
A lot of
situaciones, como en la
the
Ciudad de México,
most of the states in
varias
our country have had
millares de casos,
over
lo que
100
corresponde por un
cases
lado con la actividad de la
so
enfermedad y
far.
por el otro lado con la población. Y en la siguiente diapositiva lo
And
podemos
if we
ver
take a
en una
look at the
gráfica en
next
columnas
slide, we
que
can
nos
see
muestra claramente los números. Ahí está la Ciudad
the
de
raw
México,
data for
casi
each
10.000,
state. So you can
9.737
compare between the final
casos, seguido
numbers
de
of
poco más de 5.000
confirmed
casos
cumulative
en la
cases.
región metropolitana del Valle de México, en lo que
Of
ocupa
course, we
a los
see
municipios
the
conurbados
metropolitan
del
area
estado.
of the Valley of
Y en el
Mexico
orden
is the
que
area with the highest
reserva, hemos
concentration
comentado,
of
Baja
cases,
California, Tabasco,
and
Sinaloa
also
y
states
Veracruz
such
ya
as
se
Baja
pegan en
California,
casos
Tabasco,
acumulados
and
a
Sinaloa
Quintana Roo, que como veremos en
are
unos minutos se encuentra ya en una fase
showing
de
important
estabilización de la
concentrations of the
epidemia o
disease.
incluso en declive. La siguiente. Cuando consideramos específicamente los casos recientes, los casos de los últimos
When
14
we
días,
only
estos
look at the recent cases,
8.457,
the
la
ones that
distribución es
have
también
been
en
active
toda la
for the past
República,
14
pero
days,
tenemos todavía
then the
varias entidades que
distribution
no han llegado a
changes
100 casos
because we
recientes,
have some
Y
states that
se ven
haven't
en el mapa
surpassed
pintados de
the
color verde o
100
verde claro
case
incluso, como
um,
Durango, que tiene menos de
barrier.
50 casos
We're
recientes
talking about
registrados.
recent
En la
cases,
gráfica de columnas
active
que sigue en la
cases.
siguiente, en la próxima
And
diapositiva,
we can look at this
vemos
same
también la Ciudad de
information as a
México
bar
y el
graph,
valle, la zona conurbada en el Estado de
and you
México,
can see that
correspondiente al Valle de
Mexico City,
México,
the state of
como la
Mexico,
zona con la
are the
indiscutible
two
mayor carga
states
de enfermedad,
which
con casi
with the highest
1.300
concentration of
casos
active
acumulados
cases
entre,
as well.
perdón, casos agudos recientes entre las dos entidades federativas, seguidos de Tabasco, Veracruz, Baja California,
We
Morelos
also
y
have
Yucatán.
Tabasco, Veracruz,
En la
Baja California,
siguiente
Morelos, and
lo podemos
Yucatan
ver en
as
forma de
some of the states
incidencia,
that
esto es
have
decir, cuando
important
queremos comparar poblaciones que son de distinto tamaño, y
concentration
es muy
rates.
claro que el número de
Here
casos
we have the
depende
incidence
también
rate,
del
which
tamaño de
remember
población, donde hay más población,
takes
hay
into
más
account the
casos. Para
population,
poderlo comparar adecuadamente, tenemos que
meaning we're talking
dividirlo
about
por
the
el
number
número de
of
habitantes que hay en
active
cada entidad
confirmed cases
federativa,
per
y de ello resulta esta
100,000
medida
inhabitants
muy conocida
per
en
state.
epidemiología que se llama
And then we
incidencia.
have this
En México, en general,
measurement,
tenemos
which is
6.6
the
personas
incidence, which is
que
very
han tenido
widely
COVID en los últimos
known
14
and
días
widely
por cada
used in
100.000 habitantes.
epidemiological studies.
6.6
So we have
por
an
cada
average
100.000 habitantes. Y se distribuye de una manera heterogénea
6.61
en el territorio nacional, de acuerdo a lo que se ve con distintas intensidades del color verde
confirmed
en el mapa que
active
está frente a
cases per
nosotros, pero que si lo vemos
100,000
además en una
inhabitants
gráfica de columnas en la
nationwide.
siguiente diapositiva, podemos
And if
verlo de
we
manera
look at the
numérica en
distribution
forma
per
mucho
state,
más clara.
here we
Y
can
aquí
have
vemos
a
que la
visual
incidencia en la Ciudad de
comparison
México alcanza
between
los
the different
24 por
incidence
100.000
rates per state.
habitantes, mientras
We see
que
how
en
Mexico
el
City
siguiente
has
estado en frecuencia
25
es Tabasco,
confirmed
Morelos,
active cases
posteriormente
per
Yucatán
100,000
y Quintana
inhabitants,
Roo y Baja California, que
meaning
eran
being the
más
one with the
activos hace
highest
algunos
incidence rate of
días,
all,
concretamente hace 10
and
días,
then
ahora ya
the
están
other states
siendo
follow.
desplazados en intensidad de transmisión por los estados que recién he mencionado.
There's been some variation in these numbers recently,
La
during the past
mortalidad
week.
la representamos por el
Here we
número
have
de
the
personas que muy
fatalities
lamentablemente
distribution,
perdieron la vida
or
por
what we
tener
call the
COVID,
death
y
toll,
vemos
the
a estas
mortality rate,
3.465
and it is
personas
represented in this chart
representadas
per
al día de
date
ocurrencia de la
of
defunción en todas esas
fatality.
columnas de color azul.
All of the
Asimismo,
blue
tenemos
bars
247
are
defunciones
confirmed
que se encuentran en esta
COVID-19
categoría de
related
sospechosas,
fatalities,
que ya
and we
explicábamos
also
la
have
vez
a
pasada
yellow
cuando nos acompañó
segment,
la jefa de gobierno
which
de la
is,
Ciudad de México,
as
cuál es
we
el
have
proceso
explained,
de
and
vigilancia
remember the
epidemiológica y registro de la
governor of
mortalidad
Mexico City was here and she
asociada con COVID,
explained in
y
detail
estos
what is the process
247
of
defunciones están precisamente
registering
en ese
and
estado
confirming the
de
fatalities within Mexico
documentación
City,
para verificar
and
la causa de muerte.
that
Algunas
is
de ellas,
exactly
sin
what is
duda,
happening here. The
tendrán
ones in yellow are
la prueba
still
diagnóstica por
cataloged as
laboratorio
suspect
y las que no
fatalities,
serán
but
parte
they
de
are
este
still in the
proceso
process
establecido
of
desde
being
el inicio
confirmed or denied as COVID-19 caused fatalities. Remember, we talked about one of the resources we used in this process is that the Function Act, in which a trained professional medical practitioner writes down the cause of death. But we also use other mechanisms of diagnosis and determination in order to confirm these deaths. Here we have the fatality distribution per state. Of course, we see a pattern that resembles the one for cumulative confirmed cases, in which Mexico City has the highest number of fatalities overall, and is closely followed by Baja California, Quintana Roo, and states such as this one. Here we have the confirmed case and the suspect case distribution per date of registration. Remember, there are different ways of presenting this information, and the graphics can show some variation depending on which dates we're taking as points of reference. And we would like to remind you that the conditions that can increase the risk of presenting complications should you be infected with COVID are being over 60 years old, being a pregnant woman, and also chronic diseases such as hypertension, meaning high blood pressure, diabetes, obesity, smoking, and immunosuppression of different kinds, as well as living with HIV in those cases in which there's been a deterioration of the immune system. Then all of these populations can be more vulnerable to present complications if they become infected with COVID. Dolor de garganta, dolor de cabeza, también puede presentarse dolor muscular, enrojecimiento de los ojos, escurrimiento. So remember, some of the common symptoms are headache, throat ache, muscle pain, coughing, fever. But all of this is for normal cases of COVID or mild cases of COVID. But for those people who belong to a vulnerable group and they are at higher risk of developing complications, in a matter of hours, in a very short time, they can start experiencing more severe symptoms, such as even shortness of breath, and these severe symptoms can endanger their lives greatly. So we say this because we would like to emphasize once more that if you belong, or one of your relatives belong to a vulnerable group and they start showing symptoms, they should seek medical treatment, medical attention. Not look to get tested, but look to get medical attention. Because what is important is to have a clinical diagnosis so they can have access to the proper course of treatment. And this can be through different mechanisms. For example, there's a way of clinical diagnosis in which that is known to everybody, which is through a device that is put in one of our fingers, and in a matter of seconds it can tell us what is the level of oxygen in our blood. So these kinds of clinical diagnosis is the one that they need to seek for. Here we have the cumulative case curve. As we said, up to now we have 35,022 cases that have presented in Mexico since the pandemic started, but we had 1,562 cases, new cases confirmed in the last 24 hours. which is a little bit over 4%, which is the lowest increase we've had in a while. This doesn't necessarily mean that we are already observing a downward trend, but it is worth noticing that today's increase is significantly lower, 4.7, as I said, 4.7%.
Muy bien, pues vamos entonces a pasar al siguiente elemento. No vamos a tener la presentación
move on to the next segment.
Esta la tendremos después.
We won't be having the proper presentation of maternity care and maternity health. This presentation will take place on a different time, next week probably. So let's begin with the Q&A period. Oh, the video. Let's show the video first. And then... Yes, the video. To you that feel like you're not a good mother, who didn't have a natural birth or had a C-section, to you who were not able to breastfeed or had a very painful birth, when you saw your baby and maybe you didn't think this is the most beautiful thing in the world, maybe you don't know who the father is, maybe you fell in love with someone of your same gender, maybe you're a teenage mom and you had to keep your pregnancy hidden from others, or maybe your child has some sort of disability, maybe you decided to adopt, maybe you were made believe that after 60 you were not able to be a mom and you feel, or you shouldn't be a mom and you feel guilty. Maybe people tell you not to breastfeed in public. It's been 6 months and your body hasn't been the same. Maybe you decided to have an abortion. Or maybe you decided that your nephew, your dog, or the child of your best friend is just about enough for you. You were a parent and now you are a mother. You became pregnant after 40. You educated your children in feminism. You were late to pick up your kids at school. You're exhausted, you're tired. You were catcalled on the street. Today is your day. And maybe nobody noticed because the radio and the media talked about a perfect mother, a mother that doesn't exist. So don't worry, because the best mom is the mom that does the best she can. And all of you are great moms.
Perfecto. Muchas gracias. Este video nos lo compartió InMujeres y agradezco al Instituto Nacional.
This video was shared to us by the Women's Institute. Thank you to all, and thank you to the Secretary of the Interior, Madam Olga Sanchez Cortero, and thank you to all of the different institutions that are working and are collaborating on different fronts regarding the prevention of violence against women and its possible elimination. Remember, sex rights and reproductive rights are very important, and in order to protect them, we have a very tight collaboration between different ministries, different ministries, but especially I would like to mention the Ministry of the Interior and all of the great women that work there.
Vamos a pasar entonces a preguntas del público, y los videos. Vienen después. Perfecto. Vamos a abrir entonces a preguntas y ustedes nos ayudan a tener el tiempo para los videos. Perfecto. Por favor, usted, adelante.
All right, let's begin, and then later we can show some more videos. Lisa Alvarez from Basta. I'm going to read my question. Through a release of the INER, of the National Respiratory Institution, it was made of the knowledge of the health personnel that they don't have enough medical protective equipment, so they will have to improvise and use fabric face masks. So my question is, have the purchases that have all the equipment that has been purchased from China not been enough? Thank you for the question. Well, yes, no one who should be wearing PPA should be working without PPA. And especially those who are dealing with patients in severe condition. So these people should have timely access and proper access to personal protective equipment. So there is no reason why this should be happening. I don't know the release you just read. I'm not quite sure on the details. I don't know what's the date, what are the numbers. You said it's recent. Well, we'll look into it, but the proper mechanisms are put in place in order to different institutions to ask for support, ask for help. INER, the National Respiratory Infection Center, is not an independent, isolated institution. Is part of a network that works within the Ministry of Health, which works within the health sector, which is part of the federal government. So there is no reason why a single hospital should feel like they have to address this problem in their own way. They can come to us for support. The purchasing of equipment hasn't stopped, and the endowment of different equipment was calculated across a long time frame and across different flights. So there is no limit. We don't have a surplus of money, but we also don't have a lack of money in this regard. We'll be buying as much equipment as it is necessary. And this release or this concern will be resolved to the extent that INER authorities reach directly the relevant institutions that can provide them with support. And this probably will happen very soon or has already happened. A few hours ago, we knew of the first new confirmed case of COVID-19 in Wuhan, which was the original epicenter. You've talked about the possibility of having a second wave of the pandemic or a second cycle. What are the different measures that the government is considering in order to address this second wave? And even talking about next year, are you thinking of any preventive measures in case we have a third wave, for example? Thank you for the question. This is very important because we were talking a few days ago of what is the positive impact of the hospital retrofitting programs that were implemented as part of the preparation of the response to COVID. And they are this retrofitting of hospitals is part of the comprehensive health strategy that this administration has had since it began. So we don't have set measures that we can say will these medical units that have been retrofitted for COVID will remain active at least until the beginnings of October. Not necessarily the temporary units, the ones that the buildings that were not hospitals and had been adapted to function as hospitals will not necessarily continue to function as such after the first wave is over, but the medical units that have been retrofitted in order to especially provide care for COVID patients will continue to operate as such. Yesterday we have one of many meetings with the president and with the whole work group, and we were analyzing how can we have these benefits in a permanent way. And we had some very encouraging examples. For example, ISSSTE has a historical insufficiency when it comes to its capacity because the population has growth, but also the number of health workers has growth in different institutions, but not in ISSSTE. In ISSSTE, the number of health workers within ISSSTE hasn't increased, and we have cases of hospitals that have been abandoned. Actually, we have a hospital in Cuernavaca that had been abandoned for 10 years. And this is a new hospital that was built 50 years ago, and then for the past 10 years it has been abandoned. And then through our retrofitting programs, in less than 4 weeks, we completely remodeled and rehabilitated this hospital, and right now it is ready to be used. We are finishing the last touches, and that will be finished during the upcoming 3 weeks, and now it is now a functioning hospital. So of course we will continue with these programs in order to ensure the capacity of our health sector. And yes, about the different waves or cycles, we've talked about this. Since the beginning we said, let's prepare for a long-term pandemic. And we've said, first of all, the speed to which the pandemic will slow down, so to speak, could be significantly lower than the speed to which it started to increase in our country. But also we have other factors to take into account. For example, as we approach flu season, influenza season, as we move later into the year, it would be possible for the influenza season and a second wave of COVID to happen simultaneously. And finally, to the degree that there is transmission and circulation of this virus in other parts of the world, it is inevitable that countries will be reinfected. For example, Wuhan, which is a city that has a very strong capacity for the contention of the pandemic, hopefully this will not happen, but in other parts of the world it is almost inevitable that they will become reinfected and have second and third cycles. Perfecto.
Pregunta es qué podemos hacer las familias uniparentales, es decir, de una mamá o de un papá con hijos pequeños en casa y que no los podemos dejar solos para ir a hacer las cosas.
Entiendo muy bien su pregunta, porque
that's our reality constantly, not only mothers but also fathers. And obviously, the idea to have the entrance restricted to a single individual, it's more towards collective prevention and a community prevention, because that way we get to have a smaller number of people inside any given store, and that reduces the probability of contagion. But sometimes we've been so tight with it that we restrict a son going with his or her mother, and sometimes we're unable to just ask for help with our neighbors or a family member. I don't think that's the end of the world, but I do believe and I trust that the stores, supermarkets, and so on should exert a better criteria to fix their conditions. My suggestion is that you act as consumers, both of you, men and women, that you go and expressly say this to the stores and the supermarkets so that they exert a better criterion and they could orderly and in a regular fashion have their kids, any given mother, that could go to the supermarket with their son if they are a single parent. Of course, going to a commitment to reduce the contagion and to reduce the risk. Fortunately, kids who are younger to 20 at least, have not been identified as a risk population. When the pandemic began, we considered them at high risk because we did not know enough about the behavior of COVID 19, and we would just comparing it with influenza. But today, we do know that people who are younger to 20 years old who do not have chronic diseases are not vulnerable at all. So my suggestion is to bring it up with the manager of the supermarkets, probably put a sign up with different signatures from the population so that the supermarket can consider this criteria, to be flexible about it and to, safeguard your safe distance and, allow for this to happen, because this is a real situation. A single mother or a single father can actually reach a supermarket with their son and their kids, of course. Next question, Olivia Maria Cortez. Hello, doctor. My name is Olivia,
Hola, ¿qué tal,
and
doctor?
I'm listening you from
Mi nombre es
California
Olivia
in
Cortés
the
y te
US.
escucho desde el
Thank you
estado de
for this
California en
time.
Estados
My
Unidos.
question is the
Gracias
following.
por el espacio. Mi
If
pregunta es la
I got
siguiente.
to
Si
have
yo enfermara por
COVID
el virus que
19
causa
and I develop an
COVID-19
immune
y mi
system
cuerpo
towards
creara
it,
defensas contra ello,
this
estas
immune system
defensas estarán
or these
presentes
defenses
en
would
la
be
leche
present
materna, ¿cierto?
in
Y de ser
my
así,
breastfeeding
¿el
process.
sistema inmune
If
de mi
so,
bebé
would my
sería
baby be
beneficiado?
benefited from this?
Gracias.
What an interesting question, Olivia. Thank you very much. So, my honest answer is I don't really know. Taking into account the other types of coronavirus, it is not known that there is a transference of antibodies through your breastfeeding process. Sometimes when you get diarrhea or other types of stomach disease, it's very clear in which you would stimulate mucus immunity, which creates a particular type of antibody, which is EGA, that reaches breast milk and is transferred to the baby. But as of today, we do not know that for COVID 19. If we would take as a reference other coronaviruses or influenza, understanding that genetically both COVID and influenza are quite different, it's not known that this could happen. What we do know that could happen is that there is an antibody transference through the placenta. So when someone is pregnant, they could transfer the antibodies through the placenta, and those go circulate through the blood stream of the baby that is in the womb. It would generally, arbitrarily speaking, about in the first 6 months of the newborn baby, they would hold on to such immunity for those infections that the mother has had during pregnancy. Thank you for your question. Now, Eunice Abigail. Good evening, Dr. Gatel. I do have two
Buenas
questions for
tardes,
you.
doctor Gatel.
My
Tengo
son
dos dudas
has
para usted.
a
Mi
handicap
familia tiene una discapacidad
problem,
motriz
and I would like to
y
know
qué
what's the
estrategia se podría
strategy
implementar para
that
aquellas
what
personas
is
que acudieran
the
a un centro de
different
rehabilitación y que
measures
por la situación del
that you should have
COVID-19
on a
ya no
rehabilitation
pueden
center.
tomarlas. Y
And
la
is it
segunda,
true,
¿será posible que
or could you
puedan transmitir
possibly
media hora diaria
stream
de rutina de
rehabilitation
ejercicios de
exercises
rehabilitación física
for
en
at least half
casa
an hour on a
para
daily
poder
basis so
apoyar
that
a
you
esta
can
parte
support
de la
this part of
población?
the population?
Muchas gracias.
Eunice, I find this
Muchas gracias, Eunice.
question
Esta
really
es una
important.
pregunta también, me
Someone else
parece
had
muy
already asked this
importante.
question
Esta misma
before.
pregunta la hizo
A
una
girl who
niña
had a handicap
con una
problem
discapacidad
on
motriz el 30 de abril, cuando tuvimos la
April
sesión
30th.
dedicada
It was a
a ellas y ellos.
Child's Day,
Esperamos
sorry.
que, bueno,
So
varias
my first
cosas. La
answer is
primera
that
es,
we hope that
esperamos que
relatively
ya
soon
relativamente
we go
pronto
back to our normal
podremos
activities,
empezar a
and
regresar a
not
las
necessarily
actividades,
normal
si no
per se,
normales,
but
en el
in
contexto
our
de lo que
new
vamos a
normality, meaning
identificar como una
we're
nueva
gonna
normalidad.
do some
Esto es decir,
adaptations that are gonna
hay
be permanent in our
adaptaciones
lifestyle
permanentes
and in
que vamos a
public
hacer a nuestra
spaces
vida
and the
en
way
el espacio público, en el
public
funcionamiento de los
spaces work, whether they
establecimientos
are
públicos,
government
sociales o
oriented or
privados,
private oriented,
en nuestro
schools,
trabajo, en las
etc. And of
escuelas,
course,
etcétera.
rehabilitation is one of
Y
those
desde luego,
activities
la
that we
rehabilitación
consider
es una de las
essential
actividades
to be
fundamentales
reopened
que
very, very soon.
está priorizada para
So
continuar.
most likely within the different
Seguramente entre las
rules that we're
distintas
going to have,
disposiciones
we are
específicas
going to
se
establish
incluirá
the
la
restoration of
pronta
the rehabilitation clinics.
restauración
My
de los centros de
recommendation to
rehabilitación.
do while
Ahora, ¿qué
we
recomiendo
got
durante
this
lo que
safe
nos falta
distance
de la Jornada
campaign
Nacional de Sana
is to
Distancia?
use the recommendations
Utilizar
that
las
these
recomendaciones que sin
rehabilitation
duda
centers have
les han hecho
forwarded
los
to
centros
you
de
so that you can
rehabilitación
continue to
para
do
seguir
exercises that
aquellos
can be
ejercicios
performed
que
at
se
home.
pueden hacer en
I'm
casa.
completely
Estoy consciente
aware
que
that
no
some of
todos se
them
pueden
do
hacer
require
porque
special
algunos
equipment
requieren
that
un
is
equipamiento
located in the
específico que
rehab
está
clinic.
en las
But
unidades de
I think your
rehabilitación. Y
suggestion
sobre la
about the
idea de las
routine,
rutinas, me parece
Dr.
excelente.
Dr.
El
Cortés
doctor Ricardo
Alcalá,
Cortés
which is
Alcalá,
our
nuestro
health
director de
spokesman,
promoción de la
has
salud,
been
precisamente ha
directly
estado
in
en
contact
estrecha
with
comunicación con
those
algunas
rehabilitation
unidades
centers,
de
specifically
rehabilitación,
Teleton,
específicamente
from
la
which
Fundación
we have
Teletón,
been able to have a
con quien
very
hemos tenido también una
amicable
muy cordial
understanding.
y
And I think
productivo
that we could
acercamiento.
explore
Y
if
yo
some
creo que
of those
podemos
routines can
explorar
be
si
streamed,
algunas de esas
if
rutinas las
not
pudiéramos poner,
in this
si no
daily
como una
conference,
transmisión aquí
probably with
en la
videos
conferencia
that
diaria,
are allowed
sí
in
con
our micro
videos que estén
website. For
disponibles en
sure,
nuestro
we'll spoke to
micrositio.
Dr.
Pero lo
Alcala
vamos a ver
about it.
con el doctor
Thank you
Alcalá
very much.
hoy mismo.
Sofía Juárez,
Gracias.
go ahead.
Sofía Juárez, por favor.
Good evening, Dr. Gatel. My question is,
Buenas noches, doctor Gatel. Mi
taking
pregunta
into
es,
account the vaccination
tomando
scheme,
en
the
cuenta el
current
esquema
one,
básico de
could
vacunación,
you help us
¿podría ayudar
prevent
a
my child
prevenir
from
la
getting COVID?
disminución de ese
And my
contagio
next
de
question
COVID?
is,
Y también
when
mi
would
pregunta es,
be
¿cuándo será
reasonable
pertinente asistir a
to
sus
go to the
domicilios
health center to
a
apply the
aplicarle las
missing
vacunas que le hacen
vaccinations
falta,
during this
tomando en cuenta
quarantine?
la cuarentena?
Sophia,
Muchas
thank you
gracias.
so much for this particular
Sofía Juárez,
question because
muchas
this
gracias por esta
makes me
pregunta
identify
porque me
that
hace pensar, me hace identificar
people
que pudiera haber un estado
may not
de
have enough information
desinformación a
regarding
nivel local
vaccination.
respecto a
So,
las
the
vacunas.
national vaccination
Las
scheme has
vacunas, el
never
esquema
been
nacional de
suspended at
vacunación en
any given
ningún
time.
momento ha sido suspendido,
The one thing
en
that was
ningún momento.
postponed, though,
Lo único
was
que se
the
pospuso
national
fue
campaign of
la
public health,
Jornada Nacional de Salud
which it
Pública,
used to
que es
have
la
a
que
different name,
antiguamente
like a
conocíamos como
weekly
jornada, como Semana
vaccination
Nacional de
program.
Vacunación
This is a
y
massive
posteriormente Semana
program
Nacional de
of
Salud. Este es un
mobilization
evento
of
masivo
our health
de
resources within
movilización
the different
de los
communities
recursos de
that used
salud
to last for a
en
week.
las
Now it
comunidades
lasts
que
for 15
duraba
days.
antes una
And we
semana, ahora dura
began
15
this in
días
October
que ya
2019,
empezamos en
and
octubre de
we could not
2019
do it
y que
in
no
March
pudimos
2020.
hacerla ahora en el mes de marzo
But
de
that does not mean
2020.
that
Pero
vaccinations in
eso no
general
quiere decir
are
que la
stopped.
vacunación
And as
se
you
haya
well
interrumpido.
mentioned,
Y
Sophia,
como usted bien señala,
vaccinates,
Sofía, la
vaccines are available
vacunación,
in health
las
centers. So
vacunas
please,
están disponibles en los centros de
you
salud.
and
Entonces,
any
por
other
favor,
mother who has
usted
kids
y todas
that
las
are
mamás
missing
que tengan
vaccinations,
hijos en
please
edad de
take your
vacunarse,
kids to get those
lleven
vaccines.
a sus niñas y
Do
niños a
follow
vacunarse.
your calendar
Sigan el
established
calendario de
on
la
your
campaña
vaccine
nacional de
official
vacunación.
registration
La mayoría de
card.
las vacunas se ponen a los
Sometimes
2,
you
4
get
y 6
some
meses.
vaccinations, for
La del
instance,
sarampión se pone al año de
miss
vida y a los 6
again
años de vida.
against measles
Y
when you're 1 year
hay
old,
otros
and
detalles en
others
la
when you're
vacunación
6 months old.
que
They
están
should
ahí.
not be
Ninguna ha
interrupted.
sido
You
interrumpida.
should get them
Deben
timely
atenderse
and
todas en
according to
tiempo y
your
forma
schedule.
y los
All the
centros de
health
salud están
centers
operando,
do
tienen
have
las
them, and
vacunas
they should
y
provide
pueden
them to you.
abastecerlas y
To
deben
your other
abastecerlas.
question regarding
Respecto al otro
preventing
componente de la
COVID-19
vacuna,
and just have them
desafortunadamente
ready,
no. Tener todas las
this doesn't
vacunas para las
necessarily
otras
mean that
enfermedades
having all the
no
vaccines
protege de manera
is protecting
específica
your
para
child
COVID.
against COVID-19.
Gracias, Sofía. Eva López Chávez.
Hello, my name is
Doctor
Eva.
Gatel, may
I
I
am a
make a
Zapotec
condition?
woman, and I'm extremely
Make a
concerned about my
condition.
mother. I'm
So
afraid
I
that
need
she
to
might get COVID
transplant
19.
an animal where in New
She
Zealand
doesn't
with
speak
China.
Spanish. she speaks Zapotec. How are you going to be able to understand what she's saying? Or for her to understand what she's being told if the family members are not allowed to live with them so that we can translate for her so that she can understand and respond. And just like her, I'm sure that there are many elders in my community who don't speak Spanish and they only speak their native tongue. This is
كده
why
تأولات
my question is, how are you going to manage this? Or how are you dealing with people that are going through this disease? Thank you so very
Eva
much,
Gixi,
Eva.
muchas gracias por esta pregunta.
In the indigenous
Efectivamente,
communities
en
in
las
Mexico,
comunidades
or
indígenas, las
communities that do
comunidades
have
que
a
tienen
different
otras
linguistic
identidades
identity and
culturales y
who speak another
lingüísticas,
language,
que
we
hablan otras
continue to
lenguas,
have,
sigue
because,
prevaleciendo,
it's
porque es
part
un
of our
vicio
history,
ancestral, es una limitante
we
muy
still
antigua en
go through some
México,
discrimination
prácticas de
process in
discriminación,
which they are
prácticas
not giving their
donde no
full
se le dan
rights
los derechos
to people
completos,
who only speak a
suficientes a
single
las personas
tongue,
que
and
hablan
when
una
this
sola
language is
lengua,
not
que esta lengua
Spanish,
no es el
this is
español.
a problem.
México es un país
Mexico is a multilingual
multicultural
country and is
y
recognized as
multilingüe, y así
such
está
through
reconocido
our
por la
constitution for
Constitución
the past
ya desde
several
hace
years.
varios
So
años,
we must
y
continue to
tenemos que
press
seguir
on
presionando
the
para que
personnel so
cambien
that they change
estas
these attitudes,
actitudes en
specifically
el
at
personal,
government level,
sobre todo
meaning
el personal
our health
gubernamental,
ministry
en
from
este caso
federal
el
government
personal de
or
salud
state government.
del gobierno federal
We
o de
do
los
not
gobiernos
have any
estatales.
reason at all
No hay razón
whatsoever so
alguna
that
por
a
la que
single
no
effort
se
to get
haga
in
un
communication
esfuerzo
with people who
para
only speak a
comunicarse con
single
las
tongue should be
personas
done.
que hablan una sola
Sometimes
lengua.
it
A
seems
veces
like it's a difficult
pareciera
situation because
una situación
locally
difícil,
there
pero no
are
lo es,
so many
porque
people like
localmente
yourselves
hay
who are
muchas
bilingual,
personas como usted
and that is a
que son
mechanism
bilingües.
that
Y
works
entonces
for us.
ese es un mecanismo de
The
comunicación
National
efectivo.
Institute
El
for
Instituto
Indigenous
Nacional de Pueblos
People,
Indígenas,
who
que
is
muy
correctly headed by
acertadamente
Mr.
encabeza
Casino,
el
he's doing a
licenciado Adolfo
major effort
Regino,
and an
está haciendo un
extremely
esfuerzo
positive effort
impresionante y
to make
sumamente
sure that we
positivo
bring closer
para
together the indigenous
acercar
communities
a
with
las
their rights
comunidades
and on the other
indígenas
way
con los
around, so
derechos
that the
debidos
government
para
and the
que el gobierno,
operational units
las
from it will
unidades
exert
operativas de
and
gobierno
guarantee these
ejerzan
linguistic
plenamente o
rights
garanticen plenamente
fully
el ejercicio de
for
los
those who
derechos
only
de
speak a
las
single tongue.
personas que son monolingües.
So again, there is
Entonces,
no reason, not only
no hay
for your
razón, esto
mom.
quisiera decirlo no
I,
solamente en el
I
caso
find
de
your
su mamá,
concern
me parece
completely
comprensible
understandable, and I'm
la
sure
preocupación que
that
usted
your mom,
tiene, su
because
mamá
she's elder
seguramente
and because
por
she
ser
might
mayor
have
de
a
edad,
chronic disease,
posiblemente por
of
tener
course
alguna enfermedad
she is
crónica,
a vulnerable
efectivamente tiene un
person if
mayor
she
riesgo de
were to contract
complicarse
COVID.
si es que
So for
padeciera
sure,
COVID
not
y
only her,
necesitamos
but
que
all
ella,
people
al
who are
igual que todas
similar
las
to her
personas
condition, who only
semejantes,
speak one
mujeres y
tongue,
hombres
have
que son monolingües,
availability to
tengan la
communicate
posibilidad
their
de
symptoms
comunicar
and their
sus
concerns so that
síntomas,
they
sus
can get
preocupaciones
attention
y puedan
quick
recibir
enough.
pronta
The
atención.
different manuals and
Los
other
manuales
technical
y demás
specificities that we
lineamientos
produce
técnicos
in
de
Spanish
la
are
salud
being
que
translated
producimos en
to
español
over
están
12
siendo
languages
traducidos
at
a más de
national
12
level.
lenguas
And we do hope
nacionales
that this
y
helps
esperamos
communities,
que eso
these
ayude
manuals
a
are
que también
technical.
las
Of
comunidades,
course, they're
obviamente
not
los
open to
manuales
the
son
general
técnicos,
public,
no son
but that
para
this
que
will
los lea
help
la
that the
población,
local
pero que
communities
ayude a que
will
las
exert
comunidades en forma
and
local
understand the
existan
technical
las
practices
prácticas
that we have
técnicas
implemented
que
so that
se han
you can
recomendado para que se
execute
ejerzan
with
con
quality
igual
our
calidad
campaign
en todos los
all across the
rincones
nation.
del país.
Thank you very much, Eva.
Muchas gracias, Eva Gixi.
Now, Marcela
Vamos
Leiva.
ahora con Marcela Leiva Cardoso.
Good evening, Dr. Gatal.
Hola, buenas
My
noches,
name is
doctor Hugo
Marcela.
López Gatell. Mi
I'm
nombre
46
es
years old.
Marcela Leiva
I'm from
Cardoso. Tengo
Acapulco.
46 años. Vivo en Acapulco.
I have to take these two
Tomo
medicines, Tratalina and
alprazolam
Naproxelan,
y sertralina
for the past 10 years
desde
at least.
hace
And
como
my
10
question
años.
is,
Y mi
if
pregunta es
antidepressants
si los
make me
antidepresivos me
vulnerable
hacen ser
to
población
COVID-19?
vulnerable. Muchas
I also
gracias.
want to
Le
express
quiero
my
expresar
respect
mi
and my
admiración y
admiration to
respeto
you
para usted
and
y
your
todo el
whole
equipo
team.
de
Thank
colaboradores.
you very much.
Gracias.
Thank you for that, Marcela.
Muchas gracias
So
por sus
your
palabras,
question
Marcela.
is actually really good and
No,
really
la
useful
pregunta es buena
for
y
those
también es
who
muy
are
útil para
using
cualquiera que esté
antidepressives
utilizando
or
medicamentos
anti-anxiolytic
antidepresivos o medicamentos ansiolíticos u otro
or
tipo
any
de
other type of pills on this
psicofármacos.
matter.
Ayer precisamente tuvimos a nuestras
And we were discussing this with
expertas y
our mental
expertos
health
en salud
professionals.
mental.
And the answer to your
La
question is
respuesta es
no.
no,
It
no
does
le
not
hacen
make you
más
vulnerable
vulnerable
to
a
get
complicarse de
COVID-19,
COVID,
not
ni los medicamentos
antidepressants
antidepresivos,
or
ni
depression
la depresión,
as a
ya sea
clinical
esta como originalmente se encontraba antes de que
diagnostic.
empezara usted
So not only
en
before,
tratamiento
but
o
now
ahora que
that you are
está
in
en tratamiento,
isolation.
que
So I
espero que
hope
esté
that it was
dando buenos
working for you
resultados. Entonces
from
no
before
tema, no
quarantining
es este un
yourself.
factor de riesgo
So I hope
adicional
it's all going
para
well for you.
complicarse de COVID.
But definitely,
Lo que
I
sí
want to
quisiera
tell you,
expresar en consonancia con
and
lo que
in
decían ayer
coordination with what we said
el
yesterday
doctor,
from the
los
doctors that we
distintos
had here,
colegas que
Dr.
vinieron,
Quijada,
el doctor
Gavita
Quijada,
Vizquez,
la doctora Lorena Rodríguez, el
they
doctor Gary
said
Zabique, el
something
doctor
about
Jorge
mental health,
González, lo
which
que
was that the different changes in mood and character, all of them that could be considered depression syndrome or anxiety syndromes but in general, any mood change that could change the perception of the symptoms. For example, if someone were to have a depressive diagnosis, they could get fatigue really easily. And now they could relate that to an early COVID-19 symptom. Or someone who would have an anxiety disorder, they might not notice that they are breathing very quickly in case they did have COVID. And if COVID was already exerting a bad influence on their breathing and airway system, it could be not that, but their anxiety. So that could be very easily confused, and maybe the person is not very familiar with. So the answer is no, not the clinical assignment nor the antidepressants that you mentioned modify your vulnerability towards getting COVID-19. Thank you. And thank you for your very grateful words. Now with
Vamos
Blanca
a pasar
Fragoso
con
Oliva.
Blanca Fragoso Olivares.
Good morning, Dr.
Buenos días,
Gatel.
doctor Hugo
I
López
would like to
Gatel.
thank you and your team,
Agradezco a su equipo y a
your
usted
effort to
el
reach out
esfuerzo
to
de
the public.
realizar este
My
diálogo
name
con
is
la
Blanca
gente.
Fregoso.
Mi nombre
I
es
live
Blanca
in
Fregoso
Mexico City,
Olivares. Vivo en la
and
Ciudad de
for
México
several years now,
y desde hace varios años,
doctors from the psychiatric
médicos del Instituto Nacional de
Doctor de la
Psiquiatría,
Fuente
doctor Ramón de la
diagnosed
Fuente,
me with
me
depression and
diagnosticaron con
anxiety.
depresión y
My
crisis de
question
ansiedad
goes
y
towards
mi
mental
pregunta va
health
enfocada al
care.
tema de la salud mental. ¿Qué
What
impactos van a quedar por
should
el
we expect
confinamiento
after we
provocado por el
release the
COVID-19
lockdown of
y cómo
COVID-19?
se va a
And how
apoyar
are
a
you
las
going to
familias que
support
han perdido algún ser
families who
querido?
have lost a dear one through this
Agradezco su
pandemic?
atención.
Thank you, Blanca. So
Gracias, muchas gracias,
it's a
Blanca
very
Fragoso.
important question.
Esta pregunta es sumamente importante.
Yesterday, our healthcare
Ayer lo
professionals
abordaron nuestros
who
colegas
were experts on
especialistas en
mental
salud
health
mental, más
already
enfocado
answered some
porque
of
era lo que
your
nos
concerns.
interesaba comentar
They
ayer
already went
sobre el
over
estado
your
de
mood and your mental health
anímico y la
for
salud
those who were
mental
taking care
de los
of
cuidadores
sick
de la salud,
patients.
de
But
las
of course,
personas del equipo de salud.
general
Pero
population in
indiscutiblemente,
general are
también para la
also
población en general,
experiencing a trauma.
esto es una experiencia
Living
traumática.
through a
Vivir una
pandemic
pandemia
like
como
this one
esta
implies
implica
a
un cambio muy
radical change
dramático
in
en
our behavior
nuestro
socially and on
funcionamiento
our daily
social, en
life.
nuestras vidas
And
diarias y sobre
certainly
todo un
after
confinamiento
a
tan
long
prolongado.
term of
Probablemente en la historia
confinement.
contemporánea
For
de
the
México
for the
no haya
recent years,
existido
we
una
did not
experiencia de
have such a long
confinamiento
confinement
tan
in our
prolongado.
Mexican history.
Nos
And that, of course, changes
cambia también lo que significa
what
para
our daily
nosotros
life conditions
las
are,
condiciones de
our
vida diaria,
relationships with
la
others, with
relación con
our
los
partners,
otros, la relación con la pareja,
daughters,
con los
and our
familiares,
kids.
con
For
las
those
hijas y
who
los
are,
hijos,
distant
con los
from
que
us,
están
that we stopped
distantes, que
seeing them
dejamos de
for a
verlos
while,
por
I'm sure
periodos
that at
prolongados.
any
Estoy
given
seguro
age,
que a todas las
something
edades
on the way
se
we look at
modifica
life now
cómo
has
vemos la
changed.
vida.
For those who
Quienes
have
han
lost a
perdido
dear
a un
one,
ser
or
querido,
that you
o
know
tan
of
solo
someone who has
conozcan a
lost
alguien que ha
someone,
perdido un ser querido. Mi
someone
caso
with
es una persona con
something
una
you're not
familiaridad
familiar
mayor,
as much, like your
el vecino, la
neighborhood or
vecina,
probably a distant
el
colleague.
compañero o
It
compañera de
does has
trabajo.
an impact
Y
on
esto
you,
impacta,
and we
impacta
don't necessarily
fuertemente.
perceive
Y
that
no
in the moment
necesariamente
that
lo
it happens.
percibimos en el
It's
momento en que
known
nos
that
ocurre.
sometimes
Es
our
conocido
mourning
que a
process,
veces el
which is
duelo,
a
el
mental
duelo es
process
el
that we go
proceso
through
mental
to
por el que
adapt
nos
ourselves to
adaptamos a
this
la
loss,
pérdida. Y este
sometimes this
duelo
has different
tiene
phases, and these
necesariamente
phases
ciertas
do not
fases,
happen at the
pero
same
esas fases
speed
no
for
necesariamente se
each
cumplen a la
individual.
misma velocidad
For those
para
who
cada
have
quien.
already depression
Quien tiene
or
ya un
who
trastorno
are
depresivo
prone to
o
have
que es propenso a
a
tener un
depression
trastorno
symptom,
depresivo se
they
podría
could
precipitar
delve into
eh,
that
o profundizar,
after the loss,
según sea el caso,
depending on each
a
individual
partir de la
case.
pérdida.
So we're
Entonces,
definitely concerned
efectivamente,
about
esta
this
es una situación
because
que nos
our
preocupa
national healthcare
porque nuestro
system
sistema
for
nacional de
decades
salud
now
desde hace
has
muchos años,
very
décadas,
big
tiene también
deficiencies
grandes
on their
deficiencias en
ability
su
to
capacidad para atender
respond
la
to
salud
mental health.
mental.
We
Esto es
already
algo
knew
que ya
that and has
sabíamos y que no
nothing to
tiene
do
que
with
ver con
COVID.
COVID. Es
It's
parte de
part
estas
of our
deficiencias estructurales
of
en
our
nuestro sistema de salud.
deficiencies on our mental
Y
health
los
program.
trastornos mentales son
These two are
extraordinariamente
very
frecuentes. Los
constant.
dos más
The
frecuentes
two are
son precisamente
depressive
los trastornos
syndrome
depresivos
and
y los
anxiety
trastornos
syndromes
de
who
ansiedad,
have
que
different
tienen
variants,
muchas variantes
variants,
particulares.
various different
Y siendo
symptoms. And to be
completamente
honest,
sinceros,
Mexico
México
has been lacking for
carece
several
desde
decades
hace muchas
of a
décadas
proper
de un
mental health
sistema
care
de salud
system so that
capaz de
they could
atender los
respond to
problemas
them.
de salud mental.
Prior to COVID-19, we were already
Antes de
working
COVID
on
ya
that
estábamos
because
trabajando en
we
este
know that
empeño
violence
porque sabemos que
drug addiction, and alcohol abuse are phenomena that rose for the consequent years and that have had a negative impact in our population, and we have no means to respond to that as quickly as we would like. So COVID has now served as a prompt and a trigger for us to answer better and to find better mechanisms so that we can speed up our response time. One of the things that we were doing before and that we will continue to do is to transfer specialists and professionals from the National Psychiatric Institute towards the most needed hospital clinics that were giving first attention and that were first responders. We already have guidelines from the Pan American Health Organization through which we're looking to make this proper transfers. But of course, I want to express my deep solidarity and my profound backup to those who have lost people that are close to them. Probably these 3,500 people that have been lost, they probably became a number, but they were human beings and they were life entities that were family members. They were loved and valued, and they played a role in the life of either the family, the community, and of course the society. They are irreplaceable and they hurt. It hurt. Thank you for your question. And thank you for letting us be reminded of that. And of course, our commitment and our responsibility to respond to the second crisis that will come up after this lockdown, which is post-traumatic stress related to lockdown and the trauma of experiencing a pandemic and the losses of dear ones. Thank you. Now, Ileana Zumpano
Morales.
Buenas noches,
I'm the
doctora. Les
psychologist
soy la
Ileana
psicóloga Ileana
Zumpano.
Zumpano. Mi
By the
pregunta es,
time the
si
lockdown is
cuando
over,
termine la
we
fase de
already have a
aislamiento, ya
strategy
se tiene
in
preparada
place
alguna
so that we
estrategia para
are
que
aware
seamos
that we
conscientes
cannot go
de que
back
no
to
podremos
our
retomar nuestros hábitos y costumbres de
regular
acercamiento
routine.
social. Como sabemos en México, a
We are
diferencia
very
de otros
used to
países,
human
estamos muy
contact and we need to
acostumbrados
change
al
that.
contacto
In my
físico.
therapies,
De
I
hecho,
do
yo en mis
recommend that
terapias lo
constantly.
recomiendo constantemente. Gracias.
Thank you so much,
Muchas
Ileana.
gracias,
Definitely,
Ileana.
what you brought up is quite
Efectivamente, lo que usted
important.
dice
We
es
do have to
importante
live this
porque
new
tenemos
normality.
que vivir en
And
esta
yes,
nueva
this is an
normalidad.
element that we
Y
are
sí, es
looking
un
into.
elemento que
How
estamos
to go back
revisando,
to our new
cómo volver a la
normality by
nueva
changing our
normalidad,
habits.
cambiando
There
nuestros
are some
hábitos.
habits in
Hay
terms of health
hábitos
protection
respecto a
that,
la
in this
protección de la
case,
salud,
the ones that are
que en
relevant
este
are
caso
our
relevantes son
hygiene,
la higiene,
to
la
learn
higiene de
how to
manos,
properly
la higiene
sneeze
del
by
estornudo, de
correcting with
proteger
our
apropiadamente con
inner
el
elbows
brazo o con un pañuelo
and keeping
desechable,
ourselves
el
distance
mantenernos a
and
sana
hand washing in
distancia,
general, avoid
el
going out in
evitar
public
salir a
even
la
though we
calle o al
are
espacio público cuando
asymptomatic.
tenemos síntomas.
And those
Y todas
practices
estas
can be
prácticas se
fostered
pueden
through
incentivar con
information,
información, con promoción
but
de la
they
salud,
also have
pero también tienen un
a
componente muy
very
fuerte
important
de
background
prácticas
of
culturales aprendidas
culturally
por
learned
mucho tiempo.
habits.
Lo más probable es que quienes sean más
So whoever is in possibility of
posible de
changing
modificar
their
sus
habits,
hábitos
it's
sean
probably children.
la
This is
niñez.
a question that
Esta
we
pregunta,
had
precisamente una muy
from
parecida,
kids back
hacían
in
algunos de
April
los niños y
30,
niñas que el
from the kids
30 de
who
abril
asked the question.
participaron en la
And I
reunión,
think that's where we
y
can look at
ahí es
the
donde creo que
long-term
vamos a poder
changes.
tener los
On the
cambios de
government
mayor a
end,
largo
we
plazo.
will
Por parte del
incorporate
gobierno, sí
different
vamos a
health
incorporar
campaigns that have
campañas de
been
promoción de
lost
la
in
salud
years,
que se han perdido en
probably back
otros
in the
años. Antes
70s
eran
and early
quizá en los
80s.
años 70 y
These
principios de los
campaigns
80 eran
were a lot
bastante
more
más
common than
frecuentes
they
de lo
were
que
for the
se
past
usó en
30
los
years.
últimos
But
30 años.
definitely
Y
now,
definitivamente la promoción de la
health
salud
promotion
va a
will
ser uno de
be
los elementos
our top
cruciales
priority
de la
for the
acción de la
years to
Secretaría de
come, not
Salud
only for
en los
COVID-19,
próximos años, no
but
solo
for
por COVID,
other
sino por otros temas
but for other
importantes
reasons
como
like eating
el
habits
cambio de hábitos
and such.
alimentarios, por ejemplo.
Thank you,
Muchas
psychologist
gracias,
Iliana Zumpano.
psicóloga Ileana
Now,
Zumpano.
Carla
Vamos
Yvette
con
Segura
Carla
Gomez.
Ivette Segura
Hopefully we'll have
Gómez.
time.
A ver si nos
Hello,
da tiempo
Dr.
de...
Hola,
Gatel.
doctor Gatel. Mi
Is
pregunta
there
es,
a
¿hay
possibility
posibilidad de
of
recontagios
massive
masivos
contagion
y que
and that
volvamos a
we go
estar en
back to
cuarentena?
quarantine ourselves?
Gracias.
Thank you,
Muchas
Carla.
gracias,
Yes,
Carla
there
Ivette
is a
Segura.
probability that
Sí
the virus
hay
will
probabilidad de que
rise
haya
up
rebrotes,
again,
sí.
probably
1 o
not immediately, and we should be alert from them. When we are released from the quarantine and we begin to have a recovery of our new normal, this will lead to have contagion and other rise-ups of the virus so that we may have to have contention on either people or communities similar to the ones we have had so far. I will not necessarily say that they will happen nationwide because I think we have already depleted this option based on the very negative effect that it has had on economy and society at large. So in any given case, we would be more selective towards which communities we should control if they were to be contagious. And the next time that we may be aware of is October when influenza season begins. So we might have an intensity of COVID cases rising up, and this might represent some challenges that might be solved through quarantine measures. But again, we will be very selective or try to focus that at a regional level. And now, Artemisa Reyes Sanchez and Diana, I think. Hello, Dr. Gatel. I suffer from hypertension and have diabetes for several years now. I would like to know if I were to have an emergency, at what hospital should I go? Because my hospital, Juárez de Mexico, it's right now a COVID center hospital. Thank you. Thank you, Mrs. Artemia. So I think that we're all interested in the answer to that question because those who have turned to a hospital for other reasons that are not COVID, they find their hospitals set up now as a COVID center. That's part of the hospital reorganization that we have had. So there are other hospitals that are open. You need to be a social security beneficiary, and they do have different networks in in the network for you to be served. In your particular case, you could go to the General Hospital in Mexico as a resource to deal with the common issues that are not COVID. Do bear in mind that because you do have these two diseases, you do have a complication risk. And let me tell you that if you were to have COVID, you should immediately direct yourself to the hospital to be attended. But your question makes me just take note that we should publish publicly on our website the list of hospitals that are non-COVID hospitals that are replacing those who were set up to attend this virus. Thank you, Mrs. Artemia. Can we look at the last one? Perfect. Dr. Diana Silva. Hello, my name is Diana. I'm a gynecologist and I'm a mother. I have two kids. I work at an institutional level in a hospital that is right now a non-COVID hospital. Yes, I'm extremely worried that because I am a healthcare worker, I might get COVID and create contagion within my family. I have isolated myself from elder people, but not from my kids. That's a complicated situation. It's very difficult for me to think that I should leave them in the hands of someone else and that we would physically be separated. They are really, really small. Doctor, do you really recommend to all of those who are healthcare worker moms to isolate ourselves from our kids? Or what is your recommendation for us to follow at home so that we can continue to be together safely? Thank you, Dr. Diana. So I believe your question is relevant to all healthcare worker moms, both nursery and doctor. My recommendation is not for you to isolate yourself. So number one is that in the case of kids, they are not considered to be vulnerable or at high risk. Actually, if boys and girls indirectly, not something that should be fostered or tried, but through indirect contact get get in touch with the virus, they will not develop a high risk. And if they were to have immunity, they will get protection.
protegidas.
And when you talk about elder people, if you're a healthcare provider and you do have someone elder at home, I do recommend to find, as much as possible, find a full isolation for that person so that the elder one can live elsewhere. But if this is completely impossible, let's just try keep safe distance from them on a daily basis. Thank you, doctor. This is the end of the conference. Congratulations to your moms, you, on our reporters, and all mothers in Mexico. Congratulations, even though you're living your day through a pandemic. Thank you very much.